just want to say two things about this. The first is, thank you all very much for the work you're doing every day. It makes a huge difference in the lives of millions of families. My mother died quite suddenly, but it was a year later when my father was diagnosed with stage 4 cancer, and he asked for just one thing. He wanted to die at home. And it plunged my brothers and me into a world of advanced directives and a world of adequate palliative care that no family should have to try to navigate on its own. Now, I say every day how grateful I am to hospice. We could never have met his wishes without the help of hospice. But every day was a fight around palliative care, a concern about whether we had checked every box we needed to check to get him some care, but not have him end up in a hospital where he didn't want to be. And so I make this comment because I want you to understand, the question is not whether or not we think you're right. We've got to have the advanced care directives. We have got to have better access to earlier palliative care. I also try to follow some of the studies. The one that sticks in my mind is the New England Journal of Medicine study that studied people with advanced lung cancer, discovered that when they could receive treatment and receive palliative care at the same time, they not only had a much better quality of life, they actually had a longer life. So I think we're there on where we're trying to drive. The questions, and I'll just have to ask these for the record, although you could certainly talk about them after I leave, but I won't be able to stay for the conversation, is about the specific strategies, what we can do to get more people into advanced directives, and what we can do to get palliative care earlier into the process, and particularly how it is that we test the impact of both our directive strategies and our palliative care strategies, and do make them not just best practices, but the required practices for our entire medical community, and that's how we best serve families. So I want to say thank you to the chair for having this roundtable discussion. I've learned as I've sat here, but more than anything, I am more deeply committed than ever to making sure that we do all we can on our side to try to help families through this important part of life. And so thank you. Thank you very much, and thank you, Madam Chair.